welcome back. We're live with another one. Got a number 8 implant case today. So what you'll see here in a minute is we've got a core file. So a core file is after someone gets an implant, we take a couple impressions, or their implant is placed. It integrates, it heals, the surgeon torque tests it, says, yes, this thing's ready to restore. Patient comes back to see me. I put a scan post on it, and I scan my impression. So I send it to a company. Dentsply Sirona has a sector called Atlantis, and they digitally seat a custom abutment and then send me back the file. It's called a core file. So that's what we're looking at right now, is what does this patient look like after their custom abutment is seated. Where are those margins? How tall is it? How's it going to fit? So that I can make them a tooth to put on their abutment. We begin the same as we always do by trimming our model. Got our cut tool. Just getting rid of all of this unnecessary data that we don't need. Lips, tongue, cheek, gloves, stuff like that. If it's not pertinent to the design, we don't need it. We do not need to consider it in the proposal. Next is our model axis. Line that. Okay, that'll work. Blue dot, we're not going to touch this. Draw margin, we don't have to touch this. It's already done for us on the core file, so we're happy with that. Insertion axis, we will change. Actually, they've already got it lined up for us, so we're not even going to touch it. That would work. Next should be parameters. So in this case, we are luting, so we don't need space for silane. We don't need space for bonding agent. We just need a thin layer for cement. So 80 microns will work. However, minimal thickness doesn't need to be any more than 500 microns. So this is an anterior tooth. 500 microns is enough. Really just needs to survive the mill. So let's just jump into a proposal. We'll probably come back to the positioning tool, but let's just see how it generates. It's thinking. Okay. And here is our proposal. Now it looks like there's a little piece of plaque right there that it thinks is a problem. We know that it's not because it will just wipe off, but let's see. Is that affecting our... No, not really. I don't hate the position of that tooth, but I'm going to mess with it just a little bit. Let's change this some. So we're using our positioning tool. We're getting this thing lined up, this tooth lined up approximately where we want it. And of course, fill that space. Make sure the incisal edge is nice and lined up. The first proposal, I didn't love that distal edge. It just didn't quite match that lateral incisor the way I wanted. This one looks a little better. It looks like it might be a tad far facial. Let me see if I can't rotate this back. I really want these incisal edges to be pretty closely lined up. Okay, that's better. It's maybe a little bit long. We'll throw a grid up here and actually looks pretty good. Let's get that proposal. See what that gives us. A majority of these anterior cases is getting their like initial proposal 90% of the way there before we start messing with it. So we'll be back and forth between the positioning tool and our proposal. Let me just make sure that this constrained adoption was off. So we don't want it to change anything for the contacts. I want it to take this tooth, the position I gave it, and just attach it to the margin of that crown or of that abutment. So we're gonna turn off adapted restoration. Just uncheck that box so that it doesn't really change the contact. There you go. Now you see it. So it really just adapts itself to the abutment, which is all I want. I don't want it to change any of this shape here. I can do that myself. So let's just turn that grid off. We'll start looking at our tooth. This looks, incisal edgewise looks pretty good. Let me soften that line angle some. So the cervical to the middle third of the tooth just looks a little bit blocky to me. Use the smooth tool. See if I can't soften that some. Think of the smooth tool kind of like a melting. So if this tooth was wax and we put a flame on it, it would just melt that wax. That's kind of what I'm doing there with that smooth tool. All right, that looks okay. Now what I'm going to do after I mill this tooth is I'm going to come back with a handpiece and a diamond burr, and I'm going to manually contour this outside of the mouth. But before I do that, while we're still in the design phase, we are going to add some mammals. So we're going to turn the strength up just a touch, and we're going to go through and check our different variations. Usually I like that third one. Fourth one's okay. Yeah, the third one gives us nice tall mamelons, kind of like this tooth next door or that lateral. Let's turn on our minimal thickness here. Yeah, that I can fix here in a minute. And then, as I mentioned, I will further accentuate this with the lap handpiece after it melts. Okay, so really I think it looks okay. We're going to come through and correct some of these issues here. So minimal thickness. So let's take these upper teeth away. Check our proximal contacts. That one's too tight. We'll have to smooth that one. I know we talked earlier, we were mentioning how there was that piece of plaque on that neighboring tooth. I think that's what this is going to be showing is just that little yellow dot where that plaque is. Let's just see. Yeah. So if I turn this off, I know that that bump is not actually there. So I don't really want to give it too much respect when I'm designing on my computer. So when we look at this little yellow dot and we're like, oh, we need to get rid of that. No, we don't. It's plaque. It's going to be fine. I would be more concerned if it was creating like a concavity or like a weird surface on my crown. I think that looks okay. It's fine. I might even contour that some just to blend that out. Turn those contacts back on. Yeah, so that looks good. Distal contact is a little bit light. Well, it's heavy in one spot and then light towards the bottom. So I'm going to smooth this yellow part to get rid of that tightness. Then I'm going to bring this shape circular tool. Now I'm intentionally going to add this towards the lingual aspect of the tooth because I don't want to change really the facial anatomy. So we're just going to gently make that contact stronger, bring it down the tooth some. But we're doing all of that like towards the lingual portion of the tooth as to not change the facial contour. We're breaking the contact there. I'm not worried about that. As long as it's touching, I'm happy. That looks way better. That looks much better. Okay, now, do we want to add some on the mesial? I think we do. So let's just get rid of this. We're going to do the same thing we just did with this shape circular tool. I'm going to bring this out some towards the lingual aspect, just to kind of make that tooth more of a central shape. It's got a little thick down here. Turn the strength down so it's not quite as intense. And as I said earlier, I'm okay with that little dot, that little yellow dot there, because I know that is simply a little plaque on the skin. Which, of course, we can look at again right here. See that little bump on the tooth? It's okay. That will wipe right off. All right, contour. Do we love the shape of this tooth? It looks okay. I feel if anything, I could bring this embrasure in some so it doesn't quite come into that, like cross the midline. It almost looks like the terminal portion of this little triangular shape comes over across the midline some. Let me just soften that slightly. You can do it with post-mill processing. I'm just going to use my smooth tool here. You can also do it with a shape circular, but better. That looks better. Now it doesn't quite so much look like I'm reaching across that midline to try and close that. I'm okay with leaving that embrasure space there. Is the tooth too long? Might be the question. Perhaps I take my shape circular tool, just bring it in slightly. So that those incisal edges match just a little bit more. Only when I'm using my grid, I like to line up other teeth that I'm not working on. It's like the laterals. And if those laterals were even, I look at my centrals. Like those okay. And when I deliver this, what I may do is take a disc, a polishing disc, and just shorten this number 9 just a touch so that one, the incisal edge is more even, and two, it looks more nice next to my crown. You know, one thing I try and do when I'm working on a tooth is if there's something easy to fix next door, then I'll just fix it. It takes me 30 seconds, and you know the patient doesn't pay anything extra for it. I've never had anyone complain after I made their tooth look better. or a neighboring tooth look better, and love building that rapport. Okay, so I'm pretty satisfied with this now. I think the rest of this I can do with my handpiece after it mills, just accentuating these mamelons here. I may round that middle cervical third line angle just a touch. Looks a little pronounced for me. And I can do all that with post-mill processing. So thanks for watching. We'll see you all in the next one.